The next case is a young woman of 86 years old. She had abdominal pain, and on a CT scan we discovered a cystic tumor in the head of 35 millimeters. US FNA allows a diagnosis of mucinous cyst with a CEA of 371 nanograms per millimeters. In March 2013, US and CT scan showed a growth of the size of the cystic tumor and no communication with the main pancreatic duct. As the patient is scheduled for EUS gate therapy and alcohol lavage of the cyst. In the publication in Gastroenterology by OH et al., 52 patients were treated, and there was a response in 62% of the patients, with an anti-response in 29 patients. Let's move on the endoscopic room to find Marc Giovannini and Pierre Després.
You see the US image, and the lesion is developed in the head, and the uncinate process of the pancreas is 5 centimeter. And the goal in this old patient is to go quickly because she has 87 years old. And the goal is to do ethanol lavage of this lesion. We found an avascular area or a posivascular area here in the duodenum without any vessels, and Pierre put the Doppler, and I block the wheel of my scope, and I use a 19 gauge needle. Here you see the needle, and I will try to go straight in the cyst. Okay, we are now into the cyst, and we proceed to the aspiration. And the first step is to aspirate all the cyst, and after to proceed to the ethanol lavage. And it's very important to here you see you can focus on the syringe, and to try to see the tip of my needle. But here you see, and it's very important to know how many cc is aspirated. Here it's 10. Okay.
Okay. Oui.
Yes. And here I aspirate. Of course, this procedure is performed with antibioprophylaxis. Okay, now is 20. You see, this is the most longer time of the procedure, is to aspirate all the...
So it's very important to be sure there is no communication. So either you check this by EUS or you use EMR and MRCP
yes.
to.
And in this case, the pancreatic duct is very thin.
Yes, and that's the only way to look for communication is to have a look to the pancreatic duct before and after aspiration of fluid. If you see the duct that's completely flat after aspiration of the collection, that means that there is a communication. But of course, in such a case, you should only puncture the cyst once
to avoid to
create too many holes and to avoid backflow of alcohol outside of the cyst.
This is a very important point. And also not to cross the cyst with the needle, not to, and this sometimes I use the brake on the needle.
You have to be very careful doing this. I think the message should not be that this should be done in any cyst. This is a patient with a mucinous proven cyst without any sign of malignancy, without nodules on the cystic wall, and inoperable. So it's a good indication. I had some bad experience with backflow of alcohol outside of the cyst or the tumor. So you have to be sure not to inject too much and to only do one puncture of the cyst, because otherwise ethanol will backflow to the duodenum and may create an ulcer and the risk of bleeding.
Here you see the alcohol diffuse into the cystic cavity.
So what was the total volume?
Is 50 milliliters.
50 milliliters, yes. So you're injecting 12
12, yes.
12
This is
milliliters.
10 now.
So I saw you using a 95% absolute ethanol.
And yes.
There have been studies by Bill Brugge about the volume, the concentration.
And now, yes, and now I should wait because you need to wait 5 minutes just the alcohol stay in the wall to coagulate the wall of the cyst. And after, I will re-aspirate all the alcohol and I inject 1 or 2 milliliters of lipiodol. Why? Because this is my trick. Because the lipiodol is very aggressive also on the wall and they create inflammation and the wall when the wall collapse, this and also it's a good marker if the cyst relapse, and you will see if the cyst relapse on the solid mass. You have you see this relapse around the lipiodol spot. But you see that the liquid now it's a little bit.
The question? Yes.
Okay, now you see everything disappear on the image. Now I'm relatively happy, and I will inject my lipiodol. This is, and the technique will be, I just inject 2 milliliters because I know that I should just push the liquid inside the needle. It's a thick.
And Mark, are you anxious when you don't recover all the ethanol you have injected in the cyst?
No. I think there is nothing. The cyst is completely. You see, there is nothing. I'm not anxious in this case. I think now it's finished.